Welcome to our second community town hall on the topic of reopening schools in the fall of 2020. My name is Tim Bullis and I lead the communications and community engagement team for Chesterfield County Public Schools, and we appreciate everybody joining us today. The agenda for today will be an introduction and welcome by our school board chair, Debbie Bailey, who is our representative from the Dale District. This obviously is open to all residents in Chesterfield, but we've specifically highlighted the Dale District in this particular meeting. This is our second of 9 town halls on the subject of reopening. They are being posted on our website and all of our social media outlets as well. So for those who can't make it, we encourage you to share with your family and friends information about how they can go on and view these. After we hear from Ms. Bailey, Dr. Doherty, our superintendent, we'll go through a presentation that it's been slightly modified from what was delivered to the school board last Tuesday. An additional option has been added based on community feedback. So he'll walk through how we got to where we are today and what we're looking at right now at this point in time as we get back into focusing on the 2020-2021 school year. I think it's important right now to acknowledge that this presentation today is a point in time. It's where we are today as we head into phase 3 tomorrow. We don't know what it will look like in a month. We don't know what it will look like in early September as we actually get back to school. So the discussions that we're having today are pertinent to this point in time today. There is the possibility always that if we are to advance out of phase 3 or drop back into phase 2, that we may have to make some more changes. But we're gearing up for the school board to make a decision on which option we choose for restarting the school year at their July special called meeting on July 20th. So before I turn it over to Ms. Bailey, I'll just introduce everybody else who might be with us today for I mentioned our superintendent, Dr. Merv Doherty, earlier. We have our deputy superintendent, Dr. Thomas Taylor, our chief academic officer, Dr. Sharon Pope, our chief of schools, Dr. Lisa High, and the newest addition to our team, our chief operations officer, Josh Davis. And so when Dr. Doherty is finished with his presentation, we will be getting into the Q&A. And we appreciate the community support for that. In less than 24 hours since we sent out the invite to these meetings, we've received now well over 600 questions. Those of you who have heard about the first session earlier today, we received over 1,100 comments and questions on Facebook alone. So this is a very engaged community interested in a very important topic. So with that, let's get started and let's hear from our school board chair, our Dale District representative, Debbie Bailey.
Thank you, Mr. Bullis, and good afternoon to everybody, and thank you for joining us in this very important conversation. As he pointed out, I'm Debbie Bailey, the Dale District School Board representative and chair of the school board. Let me welcome you to the first of 3 virtual town hall meetings that I will be hosting. The purpose of the conversations is to gather constituent feedback and questions regarding Chesterfield's return to learning options, so that we can adopt a plan for the fall that best suits our students and their families, as well as our teachers and our staff. While none of us could have predicted the impact of the pandemic this past spring, I am proud of our county's commitment to ensuring the learning, that all of our students' learning continue. And we're especially impressed with how our central office staff and high school administrators worked so hard to create meaningful virtual graduation ceremonies to celebrate the class of 2020. Going forward into the fall, we are confident that our outstanding team of educators, administrators, and central office staff will continue that excellence as they plan and provide an engaging learning environment for all of our students. Regardless of what comes our way, I know we are going to do the best that we can by our students. Hearing from our community helps guide us through a lot of these tough decisions that we are facing. No matter what learning looks like in the fall, be assured that we are committed to our students, our families, and our employees. Now it's my pleasure to introduce our superintendent, Dr. Merv Doherty.
Thank you, Madam Chair. Good afternoon, everyone. I'll be presenting my presentation, and we will begin immediately. And afterward, we'll leave time for plenty of questions and responses. So the presentation that we have today for you is preparing us for the return of school for our 2021 school year. And this is as a moment of time, as we know that our phases have changed and we will be in phase 3 starting July 1st. But remembering that the guidelines for safety and health for students attending school will continue to change. But as for right now, we are sharing with you where we stand under the guidelines that we have at this time. So today's agenda, we've heard from Madam Chair. Thank you very much for your welcoming remarks. The overview from myself and then options that we are considering. Please remember that the options that we are showing you are options that were provided to us through the Department of Education and through the region for opportunities to see the variety of opportunities for our students to learn. We will definitely let you know that we are not only concerned about moving forward, but also as we've seen in several states already this past week, where now they put a hold on the movement and may be returning back to similar phases of restrictions. And we are looking forward to answering questions and closing remarks. So we believe that face-to-face instruction is the best for all of our students under normal circumstances. We want all of our students to return as soon as possible to our schools. But we are going to make sure that we follow the safe guidelines provided by the CDC. As you remember in the governor's executive order, he cited that we should follow the guidelines from all of our health agencies, not only from the state, but also from our local areas. The school board is expected to vote on the school division's plans to reopen at a school board meeting that we called for a special meeting for July 20th. That's why we are taking the time to have almost 80 of these meetings with not only our community members, but with staff personnel, students, and all of our educators and members of CCPS. Obviously, things will change depending on the phase that we are in, and we will communicate these changes and everything that we know to you as quick as possible. So we rely on the Center of Disease Control and Prevention, the governor, the Virginia Department of Health, the Virginia Department of Education, and the Chesterfield County Risk Management Team, which works closely with the Chesterfield County Health Department and looking at guidelines and for safety and health as we do in all situations concerning our schools. The executive orders we continue to review as they come out. We also know the social distancing guidelines and other health and operational recommendations. And we are waiting to see what additional phases will be announced with the guidelines changing. As I said earlier, we are seeking input from all of our staff members, family and community. We'll be dealing with additional surveys as we get closer to the school year, and you'll hear more about those and some of the responses that we have. So when we look at some of the things that we have to look at through the variables with individual family choice of in-person or virtual, making sure that all of our students have access to not only to technology through Chromebook, but also have internet access. The operational flexibility of what we can have students we can have on a bus. The number has gone from 10 total to a bus to now to 1 per seat, which could be 26, and those changes may continue to occur. Also, the amount of students we can have in a classroom. The executive order that requires face coverings. We're looking at family scheduling and how to group our students and also our students and their class schedules. So the Virginia Department of Education will review our reopening plans, but it is the Chesterfield County School Board that will make the final decision. And I want to repeat that. Our school board will make the final decision on the operations that we have for this coming school year. The states are encouraged to work with not only with the local school board, but with the local health agencies, with community members and concerns, and also looking at the facility constraints that we have with the guidelines that are set in place at this time. And we are allowed to deviate from the VOD guidance and health plans and instructions, but also we have to take into consideration the overall health guidelines from the state. and the new guidelines that will be coming out by July 15th from the Department of Labor. So we did look at risk management for guidelines because they work with our local health department and understand the state guidelines for health. And they did think that 50% capacity was reasonable. As I said earlier, the Department of Labor will be providing workforce guidelines by the 15th of this month, we were told. And that knowing that we've been asked, why do we work with risk management in this situation? We work with them on all situations that deal with health and safety throughout our school year for clarification and guidance. All of our students all staff must certify that they are coming to work well with a self-assessment. Our cleaning of classrooms, if we have an instance that is going to occur in the classroom, that we have specific guidelines from the CDC on cleaning the room and notification and making sure that we can return to the room as soon as the deep cleaning has occurred. Right now, we have an indicator that every student who rides a bus must wear a mask, and that family members can sit together on a bus. So with the options that we have reviewed with the school board last week, the option to bring back all of our students at once, we would rather err on the side of caution and safety for our staff members and students in choosing educating our 63,000 students and making sure our nearly 8,000 employees are healthy and safe. And so we are taking the guidelines from the CDC and the Virginia Department of Health, especially, and with the guidance from risk management, who's worked very hard with us to make sure we can get our offices open. So with our options, we looked at priorities, and the priorities were, first of all, physical safety of staff and students, students' social, emotional well-being, serving our most vulnerable students well, making sure that we have equitable opportunities for resources for all of our students, that that we're flexible and that we communicate to everyone with the information that we know, and that we look at the recovery of lost learning over this past semester of the spring, and plus new learning as we move forward into this school year. And that professional development for our staff is extremely important as we are working through many issues this summer. Our most vulnerable students, these groups of students will report every day face-to-face for school sessions will be all levels of English language learners, 1, 2, 3, and 4, and all level 2 adapted curriculum students with disabilities. Option 1, which we would all love to see, 100% of our students attending every day. Under the current guidelines, to bus our students to make sure we have 6-foot distancing, to make sure all students are wearing masks, the staffs are wearing masks right now under the guidelines. We are hopeful that these will change, but right now we are working under the guidelines that will be in phase 3. The 50% model in option 2, that your child would attend every other day, have instruction on Monday. If that's the day they're coming to school, but then on Tuesday they would have work assigned to them that they would complete, bring it back to school on the Wednesday, and that process would continue of not only making sure we recover lost learning, make sure we continue to push new curriculum, and make sure we have a scaffolding of understanding of learning for our students each day. All of our models, as we build our schedules, we build our schedules for all of our schools this year is that we will have a normal opening, and the opportunity that we will be grading, we will be testing, and we will take attendance every day is extremely important to know in the expectations that we have. Option 3 has a 2-day schedule for students in the building with a deep clean day and an opportunity for students and staff to have one-on-one conversations and work that they need help with or remediation, and also staff development. Option 4 is similar, except students would come 2 days in a row and then have the rest of the week to do their work. Option 4 modified, which we call option 4B, is similar. They would come 2 days in a row, and then the Wednesday would be the cleaning, staff check-ins, and professional development, with then the rest of the week the students would be at home with either option they have, either Monday or Tuesday or Thursday or Friday. Option 5 is if we can only bring 25% of our students back at one time. And again, this is a once a week with work throughout about the rest of the week. And option 6 is virtual learning, that no students in the building. Again, all of our options, including this one, have us building a regular schedule, and our students would follow their schedule throughout the day under the virtual learning. So at this point, we know that we will be in phase 3 starting tomorrow. And the other options that we have is what are the changes of capacity and what recommendations will come out of new phases, if there is a phase 4 or if there's a beyond the phase, which takes us into possibly August into September. The most viable options that we see right now is option 2, which is every other day face-to-face, 50%. And the option 4B, which is Monday, Tuesday, and Thursday, Friday, with the Wednesday being a deep clean. Again, as we move into phase 3, a month from now, we may be in phase 4 or something new, which would change where we are in the options that we're looking at. And again, we will continue to keep everyone updated. And as the board votes in July, on July 20th, they may have to come back and vote again in August because of changes to the guidelines, capacity, and instructional practices due to the change of the phases. So at this time, I would, Mr. Bullis, I would like to entertain any questions and go from there.
Great. Thank you, Dr. Doherty. Ms. Bailey, before we get into questions, are there any reflections or observations that you'd like to make at this time?
Only that I'm sure our families understand that each family situation is unique and everyone has their own perception of what is right and what is wrong and what is the best option and the worst option. So I'd like everybody to be mindful of that and know that we are trying to make a decision on what is the collective good, and what is good for the collective is not always going to make everyone happy. There will ultimately be people that are not going to be happy with whatever decision we make, which is a very difficult position for me to be as a people pleaser who always wants to make everybody happy. I'm understanding that that's probably not going to happen in this circumstance, but know that we are trying to get as much input as possible. So we really appreciate the engagement of the community in these town halls to the degree that they already have.
And it seems like we're back online at this point. We apologize for that technical difficulty. You did not miss anything. We're glad that you stayed with us. We apologize again. So at this point, we want to go ahead and move into the question and answer phase of today's community meeting. As you likely know, we solicited questions in the notice sent to families and staff yesterday, and as of 8 o'clock this morning, we had about 550 questions. That's only continued to grow throughout today. We've gone ahead and broken them down by magisterial district for meeting purposes. Moving forward, we will put together a comprehensive frequently asked questions document that really looks at the themes that parents and staff have brought forward to us over the course of the past several weeks, actually. And we will put that up on our website, mychesterfieldschools.com. So that will be coming soon. We're going to attempt today to get through as many questions as we can. We're going to do a mix. We're going to take some of the ones that were pre-submitted over the past 24 hours. And we're also going to take some of the live stream questions that are appearing in our social media outlets as well. So with that, we'll get started with the questions. Again, our audience, for our audience purposes, those who will be answering questions include our superintendent, Dr. Merv Doherty, our school board chair, Debbie Bailey, our deputy superintendent, Dr. Thomas Taylor, our chief academic officer, Dr. Sharon Pope, our chief operations officer, Mr. Josh Davis, and our chief of schools, Dr. Lisa High. So let's go ahead and tackle the one that seems to have popped up most over the past 24 hours, and that's recommendations that were released Friday by the American Association of Pediatrics. Those recommendations, which came after our last school board meeting and came on a day when we were closed during the summer, the school division works a 4-day, 10-hour work week. So we were not here on Friday, but we have submitted and are looking for feedback from various constituent groups, including risk management and the Virginia Department of Health, some guidance based on what the American Academy of Pediatrics posted on Friday. And for those of you who are not aware, they are encouraging folks to bring students back in and to find ways to mitigate risk. So we're sending that forward to those who we rely on for advice and guidance, the health experts in this field, and we'll have further comment on that in the coming weeks. Again, this will not be the only time that you hear from us in advance of the July 20th vote by the school board. So let's jump right into the questions. And as we acknowledged the first time around earlier this morning, sometimes we're a little too close to this conversation and we forget that not everybody speaks our language. So we'll start with the easiest question first. It's actually been submitted by a couple of viewers today, this afternoon already. What is virtual learning? What does it entail, and what does it look like? Dr. Pope?
All right, thank you for that. And it's completely understandable why, with all the terms that are floating around, there could be some confusion. We have online, virtual, distant, hybrid, parallel learning, and depending which website you use to look up any of those terms, you get a different definition. So I think for our audience today, what's most important is what do we mean in Chesterfield County Public Schools when we use those terms. So to be very clear, when we say virtual learning, we are going to be talking about that option that we will extend to our families who are more comfortable at this point, or as we get nearer to September 8th, keeping a child at home for a 100% virtual learning experience. There would be a virtual teacher that would support the student, but that student in a virtual learning setting in Chesterfield County Public Schools would not be attending our brick and mortar building for any portion of face-to-face instruction.
Thank you, Dr. Pope. Dr. High, the next question is going to come to you. It's from Lilith on Facebook. She wants to know, what if a parent decides not to send their child to school if we're to open? What options exist?
A family can choose to have their students learn virtually, which means that all learning will happen at home. A teacher will be designated to check in and monitor and support the work from home with that student. And there will be different modes of communication between the parent and the teacher.
And so just to clarify, Dr. High, the virtual learning opportunity actually exists with each one of these options that we've put forward so far.
That is correct.
So a family could choose to keep their child home if they did not feel like they were comfortable sending them to school.
Yes.
Okay. Is there a homeschool option too if the parent decides that they just don't want to do virtual or come to school?
There is a homeschool option, and that would be paperwork that would be completed just as we would on a normal school year if families choose to homeschool their children. So they will follow the same guidelines in previous years, which are on our website.
Okay. Thank you. Dr. Pope, next one's coming back to you. Special education is a topic we've heard a lot of during the past couple of weeks. What type of services will we be providing there? Parent Julie wants to know if the services are going to be reduced. And also if you could mix in ESY into that conversation as well, and please explain my acronym. Thank you.
Okay. So certainly a well-deserved question, because we know our students with disabilities is one of our many groups that we have high concern about. We also talk about the term vulnerable student groups, and we look in that terminology at our English language learners, our students with disabilities, and others that we know are falling significantly behind with this absence of a normal learning routine. We absolutely do not intend to decrease services in any way. Every student either would probably be served under a 504 or IEP if we're talking specifically in this question about our students with disabilities. And we know that our IEP teams actually drive the service levels, accommodations, and modifications that an individual student receives. We do talk about extended school year, ESY, as you just referred to it, Mr. Bullis, in the summer, when we try to extend learning for our students. We are continuing with ESY services in July. They are remaining 100% virtual at this time, but as we will say repeatedly in this conversation today, as we look beyond July to the forward months, we know that things can change, and we're always looking for ways to increase face-to-face assessment and instruction of our students, because we know that's best. I will say that Dr. Daugherty did already mention this briefly in one of his slides. It was probably around slide 15 in his deck. And that slide particularly mentioned our English language learners, levels 1, 2, 3, 4, and our students with disabilities are level 2 service students. So when we think about some of our students that are in self-contained classrooms, and we think of some of our special classrooms such as IDP, ADP, and our ID classrooms, we know that we already have super small class sizes in those settings. That gives us an advantage because in all of those options that Dr. Daugherty just covered, we know that we can stretch those options when we consider classrooms that already have possibly 10 or fewer students, and we can increase the frequency of opportunity those students have to come to school, receive that face-to-face instruction. So all of that's being considered in ways that help us stretch and maximize the face-to-face instructional delivery for the students mentioned on slide 15, as well as some of our other groups of students.
Thank you, Dr. Pope. This next one is up for grabs between Dr. Pope, Dr. High, and Dr. Taylor. Kara reminds us that we need to consider full-time working parents. When getting home at 5:30 p.m. weekly, there's hardly any time for school instruction. Homework is manageable, but not full-time instruction. Children are so much better in a classroom in front of a teacher. If you do virtual learning the other days, when do you expect daycares to set this up for kids that attend there on their off days?
So we are looking for opportunities to partner with our daycare centers now to provide instruction to students during the day, looking for ways to have them be trained through some of the resources that we have available for our virtual learning opportunities for students. There will be a video that will be shared with families, and so we will also share that with our daycare providers to provide them guidance and help them navigate our various platforms.
Thank you, Dr. Hunt. I want to go back and piggyback off an answer that Dr. Pope gave earlier when talking about our English language learners as well. There have been a couple of questions on the social media channels asking if we're going to provide this opportunity for Spanish-speaking parents as well. And the answer is yes, we are working on that. We're looking at a broadcast like this, as well as potentially several focus groups or vice versa. So we definitely want those families to be involved in this discussion and decision-making opportunity as well. So that is forthcoming. Next one, we talked about special ed, so we'll go to why not allow older students who can stay home without assistance to attend class virtually through their school-issued Chromebooks? And then have elementary school students come into the elementary schools and even potentially the secondary schools to reduce class size. Have we looked at that, and what was the decision on that? You want to take that one, Dr. High?
Yes, we did look at possibly spreading our elementary school students out throughout the school as well as to high schools. We found that one consideration was the number of teachers, not having enough teachers to be able to accommodate the spread of over various schools, as well as our high school spaces in terms of the classrooms and the equipment and setup there would not accommodate our youngest learners.
Great. Thank you, Dr. High, and thank you, Darlene, for that question as well. Dr. Taylor, one keeps popping up on the social media feeds that we need to go on and tackle, and that's school nurses. Can you tell us a little bit about our schools right now and what we're looking at in the future?
Absolutely. Right now, we do not have a school nurse allocated to every single school in Chesterfield County, but it is our aim to have that by this fall. We are working within our existing budget to realign funds to support a school nurse in every school building. We do have a clinic assistant right now in every school building, but we are aiming to have a registered nurse in every schoolhouse.
Thank you, Dr. Taylor. Not sure who wants to tackle this one, but again, for those who joined us late, and we're now up to close to 1,000 joining us on all the different formats that we're operating on. For those who joined us late, can somebody go back and revisit the expectations of what students will be expected to be held accountable for when they're in school in terms of attendance, grading, that type of thing?
I'm happy to review that again. We know that structure is important for our students. We've heard that clearly from our families. So moving into the fall, we absolutely expect that we will be taking attendance daily, that work will be assigned and graded, and that our students will follow a set schedule, whether they're in any of these options or the completely virtual model. So those are all part of our planning process and something that our parents can count on.
Thank you. Dr. Pope, you can stay unmuted real quick. The next one's coming back to you. From somebody watching on YouTube, is virtual learning going to be like recovery of learning this summer, and how will the work be assigned?
Actually, virtual learning will be different than recovery of learning because we're talking about new learning moving forward. With recovery of learning, we're looking back at the learning that was missed. We will have a very formal program. This would be more equivalent to what we currently call CCPS Online, where we have secondary students who take courses to earn credit. And we are going to be using a platform called Edgenuity with a CCPS teacher that will stay connected, monitor, touch base, have conversation, and help with concepts where a student may have some challenges. That is what we're meaning when we say virtual learning and that 100% virtual experience. There's still the teacher support, there's still the schedule, there's the grading, there's the expectations, but not recovery of learning, which is looking backwards at learning missed. Instead, we're going to be looking forward to all the new learning that's still ahead for that student.
Thank you, Dr. Pope. Dr. Taylor, will all students be required to get the vaccine in order to return to school if one is manufactured in time? And if so, what about parents who opt not to have their children vaccinated?
So that would require a change in Virginia law before we would require any vaccine. Obviously, that's tied to whatever timelines are associated with that manufacturer and whatever our General Assembly might adopt and our governor might sign into law. But that would not be a requirement that we would have unless it was something that was mandated by state law.
Thank you, Dr. Taylor. Mr. Davis, next two questions coming your way. As we talk about vaccinations and preparing healthy learning environments, what are we doing from an operations standpoint to make sure that our buildings are clean?
Good afternoon. Thank you for the question, Tim. Certainly having a clean learning environment is one of our very top priorities and the most top priority of us in the operations department. The facility staff, we have folks that work directly for me, and then we have folks that are school-based. Building operations supervisor, day porters, they're going to be involved while students are at school, keeping restrooms clean, monitoring the building, assisting teachers and other staff members whenever possible if a cleaning chore is needed. Any disinfection as a result of whatever might occur would not take place in the presence of students. And but then we also have contract custodians that have been working with us for several years. We've changed a couple of the companies, but they are going to be on staff. They'll be working afternoons and evenings to continue to clean the buildings and have them ready for the next day. If we have a day such as a Wednesday devoted to cleaning, All of those staff members that I just mentioned, in-house and in contracts, will be involved with cleaning the buildings. High-touch spaces are very important. They'll be attended to 4 times a day. Restrooms 4 times a day. Eating surfaces throughout the day. So again, it's not going to be an easy task, but it's going to be one of the most important things that we do.
Thank you, Mr. Davis. Next one coming your way is we will be sharing with parents the same information that we shared with staff members earlier this week. That's some questions that you should ask your child and ask yourself every day before you send your child to school. We certainly want them well when they come to school. But that first thing that they get on, or the way they get to school after they leave that house, is quite often our big yellow school buses. We have 48,000 children who ride school buses on a daily basis. How do we plan to look at transportation and getting children to and from school safely for this year?
Yeah, transportation is an extremely important resource, and it's a highly logistical, complex operation where many of our bus drivers go to 3 or 4 schools every morning and afternoon. And it very much appears that our capacity is going to be restrained. Dr. Doherty mentioned the ability to hopefully put 1 child in every seat as opposed to spacing them out 6 feet apart. That kind of a configuration would reduce us to 10 children on a bus and really very, very much limit what we could do. However, again, in consultation with risk management, we think we can go with at least 1 child in a seat. Siblings would be able to sit together. So hopefully we're going to see 20, maybe as many as 30 children on a bus. So we're going to need some help from parents. Many parents that have expressed their desire to bring the students back to school have said they will do the bringing, they will do the transporting if we can open our buildings. And we're going to need that help, frankly. Even in the scenarios where we're bringing 50% of the students to school, parents that are now willing to bring their children to school will certainly be of great assistance to us. Our bus driver is going to be very important. We've had shortages of drivers in the past. Our Human Resources Department is doing a great job of recruiting this summer. So we're training new drivers, but I think we're going to be concerned about all of our staff's absenteeism, whether it's school bus drivers and teachers and so forth, when we have these exposures in our families that might limit us to our ability to go to work. So we're going to be managing that from day to day. We're going to be communicating with the community. I don't want to overpromise in transportation what I might not deliver. If we know that it's going to take 2 rounds of buses to bring students to school and some groups are going to appear before others, then that will be it. But we'll communicate it and make sure that expectations are well known. So thank you, Tim, and I'd be happy to go further if there are any further questions.
Thank you, Mr. Davis. I think the other piece that certainly came up earlier in the morning is if we're going to have an increase in the number of parents bringing children to school, that we need to work with the police department to make sure that there's some traffic control in our school areas. We're prepared to do that, correct?
Yes, we are. We need to survey each of these parent pickup locations and do the best that we can at each school to maximize throughput. And having some partners in public safety on hand, especially those first few weeks until we get into a rhythm, is going to be vital. And I know that the police will be ready to assist us.
Great. The next question comes from Annie, and she wants to know if our teachers will be given the proper amount of PPE if we go back in person. And also, will classrooms be provided with a sufficient amount of cleaning supplies as teachers normally buy that for their own classrooms in a normal situation? Mr. Davis. Mr. Davis, we need to unmute. There you go.
There we go. Unmute. You got me 4 in a row here. I thought I already had strike 3 there, Tim, but no, that's okay. Yes, PPE. We've already bought masks. I believe that we're going to be issuing every employee mask. Some professions will require gloves, and it might be the teachers will need those from time to time to clean up the spill. So masks will be available. All the bus drivers are going to get one. I saw a comment on the earlier Facebook from one of our bus drivers, and she had the question, so I've already answered her. They're going to be issued a mask. We may actually use some of the face shields. That's been discussed for both teachers and bus drivers. Those shields might be more effective in regards to helping communicate, but they might be a little less effective in regards to spreading the molecules that come out of one's face. So we're going to have to be careful about who's assigned which kind of PPE, but we're striving very hard to order what we need well in advance. And again, the employees with the most PPE are probably those folks that are going to be doing the cleaning and disinfecting. They're going to be wearing not only masks and gloves, but safety shoes, and they'll be changing those things multiple times a day. So big focus to get the PPE in place for all the folks that need it.
Thank you. We're about halfway into the meeting so far, and so just wanted to recap for those people who have just joined us. Excuse me, we're in the process of looking at a number of options to return to learning in the fall. Those are available on the school division's website. Racine just joined us and wanted to know if a decision had been made. A decision will not be made until the school board votes on July 20th. That is a special called meeting. They will be taking up this topic at that meeting. But I think it would be fair, again, to caution everybody that we live in a society right now where things and information seem to change and turn over rapidly. So we will be watching this and monitoring this all the way up until the first day of school. If we move out of phase 3 or if we move back to phase 2, we will adjust, bring forward recommendations again, and share with the community again. So let's get started with the second half. And as we look at the social media feeds, I want to thank Hagen, who says, "Thank you for all that you do. This is a huge logistical undertaking." So to our staff on this call, I just want them to know that the community appreciates all the work that will go into, as we like to say, moving a battleship on a dime, which is kind of what we're being asked to do. The next question comes from Loretta, and this will probably be directed to Dr. High. Will there be field trips, dances, concerts, all the regular things that school has to offer beyond the core classes?
As we're allowed by guidelines, we're looking forward to resuming these great enriching activities and experiences. We know how much they add to our students' experiences. So when we are allowed to, we will definitely look at those things.
Okay. And I would add that we are working in concert with the Virginia High School League regarding sports, whether it's the fall season or summer practices. Right now, they're on a pause. They're waiting at least another month to see what the data is at that time. Jennifer wants to know what will be done in a school if a child tests positive in a classroom. Will the school be shut down temporarily and then reopen? And how will we provide assurance that others won't get it if we stay open? Dr. Taylor, do you want that one?
Sure, I'd be happy to. We have a commitment to our families, our students, and our staff members to follow FERPA, the Family Educational Privacy Rights Act, and HIPAA. So we won't be disclosing sensitive medical information. However, we will be doing contact tracing, and we will ensure that all of our students and staff members are safe. And those that are potentially exposed, we will contact them to the extent that we're allowed to by law. We will be following up with extensive cleanings of areas that may have potential infection, and we'll be vigorously pursuing this, but we won't be disclosing broadly names of infected people or anything along those lines, but just following what the CDC guidelines have laid out for us in terms of what is appropriate and and contacting those that require action.
Thank you, Dr. Taylor. Dr. Pope, Dr. High, Colleen wants to dig down into a specific curriculum area and wants to know about career and technical education classes at our 2 CTC centers. How would we do those? And let's expand upon that and talk a little bit about scheduling. I know there's a rumor out there that we've already moved to a 4x4 schedule, so let's go ahead and tackle that one as well.
I can see Dr. High and I watching each other through the screen to see who's going to unmute first. So I'll try to answer most of that, but please, Dr. High, join in if I've left something off. At this time, we are not entertaining the 4x4 schedule. There are some complexities in that probably do not bring the benefits that it could yield. I say all of that with the caveat that we do remain open to every option, though, because as things change, we need to be flexible and grab onto whatever will work given any future situation that we're in. For CT, especially our technical centers. When we talk about special groups of students where we have to consider instruction in a different way beyond the options that Dr. Daugherty clearly laid out for us, of course, this is one of our areas of focus. We realize that there are certain learning programs that it really requires some hands-on learning, and we can only do so much of that through courseware and through even specialized virtual tools that we might push out. So one of our considerations right now, and we're fortunate because with regulations, our CTC technical classes tend to be much smaller in size. We're looking at that possibility of being able to bring in those students consistently to have that hands-on experience so that they can continue in those learning classrooms where they need to have that hands-on experience. We fully intend to move forward with our technical center programs and our offerings this coming school year. And we do have models we've already drafted to give our students those much needed hands-on learning experiences.
Thank you, Dr. Pope. Dr. Taylor, this one's going to come your way. Karen has asked several times on our Facebook feed if we can provide the clinical evidence that we're using to make our decisions. And you want to talk a little bit about the guidance from the health experts that we're relying on, given that we're more educating, more experts in education?
Yeah, absolutely. And we are an educational organization, and we are not a medical organization. So we are heavily reliant on guidance that we're receiving from outside agencies. The agencies that we are receiving guidance from include the Virginia Department of Health, the Center for Disease Control, and the Virginia Department of Education. Internally, we have a shared service with our county government, which is our risk management department, and they are evaluating all of the guidelines as provided by the CDC and the Virginia Department of Education, and giving us recommendations on what seems to be most feasible given our constraints. In terms of actual medical evidence, that is not our expertise, as Mr. Bullis noted. We are taking those inputs as we receive them, and we'll make a recommendation to the school board based on what we are allowed to do per the guidelines, as well as what is going to be in the best interest educationally, as well as from a safety standpoint for our kids.
Thank you, Dr. Taylor. Ashley on our social media wants to know, would it be best to focus only on the core academics for our students and reintroduce electives when it's safe to return? That was a topic of conversation earlier this morning as well. Dr. Pope, Dr. High, will you all address electives, not just at the secondary level, resource classes, and how important they are at the elementary school level too?
So we have asked our principals in our meetings over the last couple of weeks to look at their schedule and to develop, to the best of their ability, a normal schedule where all content and elective opportunities are available to our students. There may be times where we may have to do some adjustment in the length of some of those offerings, but we do want to provide electives because we know that there are some students who really excel in some of those components of their learning. So we want to address all of the different learning modalities of our students.
Thank you, Dr. Hatt. Ms. Bailey, this one might be best served up to you, and taking into account that our July meeting is scheduled to be in person. I think you'll see a shift there, but she would like the board to explain why we're having virtual community meetings to determine if teachers will be teaching in person. If it's not safe to meet in person for a board meeting, how is it safe to be in schools in person?
Dr. Taylor will verify that I actually said that to him yesterday. And we will be having our face-to-face meeting in July. There will be a public board meeting when we enter into phase 3. Phase 3 doesn't technically start until tomorrow. So we were still going by the guidance of phase 2, and we were meeting virtually. I think you also noticed the Board of Supervisors is holding their first public face-to-face meeting as well. And so we will do that in July. So the public is welcome to attend under whatever guidance that we have to follow for face-to-face meetings. But yes, when we vote on our return to learn plan, it will be in the public meeting room. July 20th, and it will be a face-to-face meeting, barring any change between now and then. But as of right now, I have been the one advocating, I want to get back face-to-face, probably more than anybody else. But I understand we need to be safe, we need to be cautious and careful with all of our constituents and having them come and speak to us. This is our best option at this moment in time, but we will be moving to public meeting in July.
Thank you. Dr. Pope, Dr. High, Catherine asks, would it be possible for students to keep the same days each week? I think it would be much less confusing for families to know if their children go to school on Tuesdays and Thursdays or whatever it may be, if it were just consistent.
So if you look at options 2, 3, 4, and 5, as well as 4 modified, that is exactly what we're looking at, so that students will attend the same days every week, which will make definitely a more consistent schedule, and it will cause less confusion for all areas. So yes, that is something that we're considering in 4 of our options.
Thank you. And would you like to follow up with how we're looking at dividing students up to make sure that there's a balanced schedule?
Well, we've looked at whether we can do this alphabetically, 50%, and have students attending who are in the same family, so that it will be easy for families to know that all of the students in their home will be coming to school on the days that they are face-to-face, as well as the days that they are learning from home. So that's how we're looking at that, as well as looking at how that will work with transportation as well, in terms of addresses.
Okay, thank you. Catherine asked the following. This pertains to all of the in-person plans. If a student comes to school and feels unwell, what are the plans in place for that child if the parents are unable or unwilling to come pick them up? Typically, a student is sent back to the class unless they're physically getting sick. Where will we put these children, and how will we require parents to come get them if they get sick during the school day?
We definitely will be contacting families if a student is sick. We had this conversation yesterday in a meeting where our nurse supervisor talked about looking at 2 different locations in our buildings to have clinics, so that if we have some students who are showing symptoms of the virus, that they would be in one area, where we may have a student who has fallen and has a bump in a different area. And so we will put until families can get to school, we'll put them in an area that will keep them away from other students to mitigate any additional risk.
Thank you. Dr. Taylor, Dr. High, I'll leave this one up to you all. Jessica writes in, what are the options for teachers who are at high risk, or teachers that are healthy but live with high-risk family members? If teachers do not feel comfortable and safe coming into the building, what options are there to work from home for that teacher? The governor stated that telework must be offered. Please clarify.
Yeah, actually, this is covered under some protected guidelines. We would encourage any staff members that have concerns about this to reach out to our benefits office, because there are a host of leave options that, depending on an employee's circumstance, that they could potentially qualify for, and we could utilize. We do want to have as much of our workforce assigned to the locations that they are typically assigned to, depending on whatever scenario we move forward with. That's obviously what's in the best interest of our kids academically, but we will make arrangements as protected under federal and state regulations and laws to make sure that folks get the appropriate leave if they qualify for it. And the best way to do that is to reach out to benefits@ccpsnet.net, or to go on our website and call the benefits office, and we'd be delighted to talk to you about it.
Thank you. Dr. Pope, Dr. High, Stacy asks, will the planning day be left alone so that planning can really take place, and so that other virtual remediation through small group instruction can take place?
So again, as those options were reviewed, some of them do contain a planning day for teachers. Not knowing exactly where we will go as a school system with those options, first and foremost, let me say that teachers are guaranteed their planning, as we have asked principals to create master schedules that follow the typical school day that we're all used to. And in that typical school day, teachers are allotted planning. So that will naturally fall within their normal day. If there is an option chosen that has the additional planning day where we will be deep cleaning the building, teachers will also be able to use that day. They might have faculty meetings virtually that their principal may ask them to attend. They might have PLCs. They can have planning during that day as well. And that would be a day where we would expect them to have some of those one-on-one conversations and reach outs to our students and our parents as needed. I will say that I want to clear up, because I think there might be some teacher confusion, that if you are a teacher in our school, following the schedule that your principal has set, you're responsible for the students on your roster. We are anticipating that in a hybrid model, 50% of them could be with you in your classroom on a given day, and they would rotate, and the other 50% would be engaged in what we call distance learning, where they have the same teacher, the work that the teacher has assigned to them, that teacher will be grading the work, and then those two student groups just flip-flop. So I might have 50% of my students Monday, Tuesday, for example, my planning day on Wednesday, and then the other 50% of my students in my classroom Thursday, Friday. When not in my classroom, those students would be engaged in the distance learning that I have assigned to them as a teacher. Those student groups are completely separate from our students whose parents may elect to keep them on a 100% virtual option. So the teacher would not be responsible to manage those 100% virtual students in addition to those two cohorts of 50%. And I think that's important for our teachers, because I think that would be asking just entirely too much to manage three separately paced groups of students. So just wanted to make that clear, because I think that might have been a little bit of what that question was getting to.
Thank you, Dr. Pope. We have some more folks who have joined us since we started, and so I do, with 30 minutes left, want to backtrack. One of the questions that's come up is, what are the options that we considered most viable in the presentation earlier? And for those of you who want to go back and look at those options, they're available on mychesterfieldschools.com. We acknowledge that option number 2 and 4B, which is new from June 23rd, are the most viable options. And 4B, just for those who are jumping in a little bit late, includes a cohort of students coming in on Monday and Tuesday, with Wednesday set aside as a cleaning day in schools, and also teachers doing planning and small group instruction for students who need some individualized assistance. Then the second cohort of students coming back in on Thursday and Friday. Next question, Dr. High, it deals with scheduling. We have a parent who wants to know, if I make a choice now about what I want to do, can I change it? And what do I need to do to change it?
We are looking at the schedule, and you would be making a commitment for a minimum of 9-week period, so a quarter, and then we will be able to pivot once at each quarter what the next learning opportunity would be, because our goal, of course, is to get every student back face-to-face, so we want to be able to pivot to that when the opportunity presents itself. So yes, you would be able to make a change probably at the quarter.
Thank you, Dr. Hyde. Let's keep you on real quick. If we could revisit the daycare issue, how we're going to attempt to work with daycares to support virtual learning, and then maybe Dr. Taylor to talk about staff and staff who have children, how we can support them as well.
Okay. So in terms of daycare, we have a list of daycare centers that our students go to. And so we have a team who are working to reach out to daycares to determine how we can partner in the instruction together. We will provide them the same information that we would provide parents in terms of professional learning, how to use some of our digital programming and such. It's definitely a work in progress. There may be opportunities to even have some teachers make some connections with daycares on a regular basis to check in with the cohort of students who are there.
Great, thank you. And Dr. Pope, can you revisit one more time for those who are just joining us or who have joined us since we first tackled it, how we're going to support distant or virtual learning from home for parents who may not be available during the day to support their children?
So for the parents who select virtual learning, which is 100% at home, we will have a teacher assigned to those students who elect or their parents elect to have them engage in 100% virtual learning. The teacher will do check-ins with the student. There will be virtual office hours set. There will be work assigned through the teacher. The progress of the student will be monitored. Parents will be contacted if a student falls off pace with that online learning. And most importantly, these are VDOE approved courses. There will be grades, and it will be new learning that the student will potentially be earning credit for.
Thank you, Dr. Pope. I think that last part is important for all parents to understand. That differentiates between the spring of 2020 and the fall of 2020. Our expectation this year is that we will be taking attendance, that we will be assigning work, and that it will be graded, and that students and parents will have access to that. So that is definitely something that's different from the spring that we believe will help make this fall program stronger if we need to go that route. Next question comes from Wendy, and she wants to know if parents will be able to request which 2 days our students will attend school. And that dovetails into another question, which asks, are we going to work with the business community to share this plan with them so that they know the disruption that might occur in the work world?
So I'll jump in there and say that we absolutely will be sharing our thoughts with business partners as we move into the decision phase and a recommendation to the school board. We are obviously very sensitive to the impact that this has on the broader community. It's important to be mindful that we would love to say that instruction is our number one priority. The reality is that student and staff safety is our number one priority, and that our number two priority is instruction. So that whatever recommendation we move forward with is going to lead with safety as its number one objective, and the optimal learning environment as our secondary objective. In terms of choice, to be most equitable, it is our intent to if we are in a situation where we are providing instruction in a face-to-face environment for 50% of our students, to do it in an equitable way and to do it pretty concretely and simply. That would limit parent choice. We would be assigning those days based on the model that we would recommend and subsequently have the school board approve. And it would be our intent to also keep families together. If we did this alphabetically, some families do have different last names in the household, and that's all right, and we want to account for that. But much more than that, we would stick to an assigned day and try to get that locked in as early as humanly possible on July 20th. All of this being said, and this cannot be stated enough, and restated again and again and again, all of these plans, all of these recommendations are very fluid and have a huge caveat to them, that this is our phase 3 opening plan. Should the state government move us into a different phase or a different environment, we will have to come back and revisit this, and we will have to make adjustments and new recommendations to the board. But should we find ourselves in a position where we are opening in a phase 3 environment, this is the hand that we've been dealt, and the ones that we'll make recommendations from to the school board.
Thank you. Dr. Pope, Jill asks, will the curriculum pacing guides be adjusted to support the time lost in the spring, specifically for elementary school students?
So absolutely, we all have that concern about that lost learning that didn't occur for any of our students this past spring. We are already with our curriculum team, we've identified the strands of our SOLs, our standards of learning that were not covered. And then even more important than what was not covered, what we call the power strands, those bits of knowledge and skills that are required for future learning. So in other words, they provide the foundation for what will be learned this coming year and years after. So we've not only identified what was missed, but we've then highlighted what are the power strands, those essential pieces of knowledge and skill that a student must master to be able to be successful moving forward. And those power strands have been embedded into the curriculum for this coming year and for the next 2 years, so that students will have repeated exposure, very naturally woven into the learning that they already have planned for this coming year, so that there will be multiple opportunities to make up that lost learning, and that the teachers won't each be independently responsible to try to figure out that big jigsaw puzzle. So absolutely, that has been presented to principals, and it will continue to be presented to our teachers as they come back and as they prepare for this coming school year.
Thank you. Dr. Taylor, Stacy just asked if children's mental health is being considered as much as their academic success. Can we talk a little bit about what we're doing with the federal money that we're getting that's related to COVID?
Actually, delighted to, and thank you for bringing that up, Stacy, because this is something that I think will make Chesterfield County Public Schools a little unique, and a point of pride that we can all reflect back on later and be really happy with. You may recall earlier this year, the board adopted a budget that was groundbreaking in the level of new staff and support that we were providing to our kids in the form of mental health services and counselors, as well as special education teachers and teachers for English as second language students. Because of COVID, that has adjusted our revenue projections, and as a result of that, the board had to cut $23 million out of its budget, which was pretty substantial. The state also had to cut a substantial amount of funds from its budget based on revised revenue projections. And one of the things that the state cut was its support for counselors and mental health supports to go into schools. We have chosen to use a portion of our federal CARES Act funds to support having those counselors in place in our schools, because we know it's the right thing to do, because we know our kids are coming off of a pretty traumatic experience, and they are going to need a lot of wraparound services to help support them as they reintegrate back into a brick and mortar setting, whether it be in part or for a majority of their school time. So with that, you never really want to use an ongoing expense with one-time money. And so using stimulus money for an ongoing expense like personnel is usually not a great idea. However, we know that there are designs to add this back into the state budget. And we see this as a priority, and that the social emotional development of our young people is a huge priority for this school division. One of the phrases that we've adopted in Chesterfield County Public Schools is we believe in Maslow's hierarchy before Bloom's taxonomy, meaning that we must meet the fundamental needs of our children first before we can address the learning needs of our children. And so if we are not taking care of our kids from a whole child perspective, we're really missing the boat. So this huge infusion of additional counseling staff is gonna be a big impact on our schoolhouse experience for our kids, and we want our new personnel to welcome our students with open arms, so that they can address any issues that may have transpired during their absence from the schoolhouse.
Thank you, Dr. Taylor. Dr. High, we've got, it looks like a good number of parents on this presentation who were joining us for the first time, not that you recall, but as first-time members of Team Chesterfield. And they're interested in learning what supports will be available for kindergarten students who are making that huge transition into a stabilized school setting and a structured school setting, given the uncertainty that we have.
And so this week, as staff have returned back into the buildings, kindergarten registration is opening up for families with appointments to come in to finalize the registration for students. Our principals are working with staff to create some orientation type activities, whether it be face-to-face or virtual opportunities, to help prepare families for the start of school. We know that as kindergartners, it's a little exciting, but it's also a little scary for our students. And so we want to make sure that everyone feels welcome and knows that we're going to be support. We're looking at our unified health support team to also provide some social emotional activities and professional development for our teachers to better support students when they return.
Thank you. Dr. Pope, Dr. High, this next question, Kristen must have been reading my mind. She just put it on social media, and I was actually just getting ready to read her question from the pre-submitted question lists. If the students are in school for any amount of time, what happens if there is another significant outbreak of COVID-19, an outbreak where all schools are forced to shut down and we are back to square one? What is the backup plan? How will CPS handle another full closure of schools should it happen again?
So I am so glad to have this question because I definitely want us to be clear and transparent with our community that our first round at virtual learning, while we had some phenomenal examples of amazing work by our teachers, we know that the experience was not the same for every student. And we know that we can do better if we have to go back into a 100% virtual scenario, if there's an outbreak, all of those things that Kristen mentioned in her question. So what are we doing to ensure that we will be better in round two if we should face this situation again? And, you know, I would say that I'm convinced I'm accurate in saying that all educators are continuous learners. We all want to learn and improve. And one of the things that we know is that if it strikes a second time and we're not better the second time around, then shame on us, right? Because we missed an incredible opportunity. So some of the things that we've done to prepare for a what if we're all at home again for an extended period of time, we've actually started with our teacher preparation. Our teachers were not prepared to turn on a dime and begin teaching 100% virtual for 14 to 15 weeks of the school year. We have offered professional developments that are very specific since COVID-19 in distance learning pedagogy, how to meet the needs of our special student groups, and what are just basic best practices. And to the credit of our Chesterfield County Public School teachers, we have had thousands of registrations for those professional development opportunities. So first and foremost, our teachers will be so much better prepared for whatever we face in the future. Secondly, I would say that as a district, we have invested our dollars very wisely. We have purchased courseware for our secondary students in all subject areas, with the exception of just a few electives, so that if a child has to remain at home for any period of time, they can receive VDOE approved lessons that come with assessments, that teachers can engage in the instruction with the students. We know we have VDOE approval, and we know that all of the basic standards of learning will be addressed, and that all the knowledge and skills needed for mastery to move forward will be addressed. That provides consistency across our county, and it's a baseline of courseware for all of our secondary students. We didn't have that this past spring. We also know that for our youngest learners, phonics and reading instruction is so critical, and it is certainly difficult for our youngest students to receive virtual learning. But without an important tool to help practice those phonics and those literacy skills that our students in our pre-K, kindergarten, first and second grade levels are just beginning to develop, we're not going to be able to bring them to the point of reading mastery that we need to by third grade. So we've purchased a product for all of our students in our district so that we can have teachers working virtually with flashcards and sounds and engaging fun activities to build those literacy skills. So we have added so much to our digital toolbox so that we can push better instruction to our students and make it easier on our teachers. Because when our teachers have to build from scratch, we know that we don't get consistency across our county. So I think our district preparation in those areas, plus what we've already mentioned, right? We're going to head into any type of round two that we face with set schedules, with attendance being taken, and with work being graded. All of those things I just listed guarantee we're going to be better at this the second time around. And that's always what we want to be in Chesterfield County, right? Better every day at providing the learning our students need.
Thank you, Dr. Pope. Dr. High, if you could tag team with that. She talked a lot about how we've invested in programs and people. Let's talk a little bit about the technology investment we've made too.
Yes, and I just wanted to add one other thing is in terms of how to support our families, we're looking for ways that we can also provide some checklist or guidance for our families as well to make it a little bit easier for them, because we know that they did not go to school to become teachers and educators. So we want to make sure that we provide that. But in terms of our technology, and when school went to home learning in March, we were 5 through 12 one-to-one. Since that time, we have focused on our 2nd through 4th grade students to become 2nd through 12th grade now one-to-one for as many students as we had requested devices. Over the summer, as we're doing recovery of learning, we're looking at continuing to deploy devices as well as our hotspots so that there is accessibility to the internet. By the time we start in September, our goal is to be 100% pre-K-12 one-to-one with devices, as well as working with Comcast Essentials to provide access to the internet at home. And for areas that may not have the internet access through Comcast, we're looking at hotspots to provide cellular access to families. So we're going to be a district that is going to be pre-K-12, and that's a pretty big piece. But we're up for the challenge to do this for our families to make sure that we are equitable in the learning opportunities.
Thank you. Dr. Pope, this just came in from somebody watching us on YouTube. They're concerned that if we're planning for 3+ scenarios, the quality of the work may not be as good. Why not just focus on one? How are our teams putting together plans that would address all of the needs of all of our students in these plans without sacrificing anything?
I think I lost sound there at the beginning of the question, Mr. Bullis. Could you, I'm so sorry to use up the minute and ask you to repeat.
That's fine. We have a parent who is worried that if we're preparing for 3+ scenarios, that we might lose some quality by broadening and not going focused. What are we doing to prevent that from occurring?
So I think all of the planning from the Division of Teaching and Learning has been focused on the worst case scenario. And I'm going to just use my personal opinion here that the worst case scenario is that students are at home and not in front of their teachers in our own brick and mortar buildings. So all of our planning has really been focused on that one singular plan of worst case, how can we provide the best virtual learning experience? Because we know any opportunity beyond that to bring our students back partially or fully just makes the work so much easier. So I understand it's difficult because there are a lot of details to work out, but from a Division of Teaching and Learning standpoint, we're very singularly focused on the best learning opportunity, regardless of how we float in and out of these different options possibly.
Thank you. We've got a little slightly less than 10 minutes left, so I'm going to begin to wrap up. And I'm going to give this one to Dr. Doherty and Mrs. Bailey to give kudos out as well. We did turn a battle on a dime this spring. And as Stacy acknowledged on social media, our teachers rocked. But it wasn't just our teachers, it was our parents as well. We asked them to do something that they hadn't done before and maybe weren't necessarily prepared to do, and they rocked as well. So Dr. Doherty, you want to address parents and Mrs. Bailey teachers or vice versa?
Well, thank you, Tim. No, I think our parents did a great job under very challenging situations, and I don't think there were two families under the same type of pressure in trying to deal with the students being at home full time, understanding what education is really like, and we really appreciate the feedback that we receive from our parents. We could do a better job. And I think that was a valuable piece for us, is that we were all over the spectrum of some great teaching and some teaching that had to improve, and the contact time. And so we really got a lot of feedback from parents on what we do better to help them, but also that they really made a strong effort and a gallant effort to help their children get through this time. And what we want to be able to do now is, as we come back to school, is to make sure that we not only catch our students up in the learning that was lost, but also that moving forward. And we're there to our parents and to our students. But they just did a great job of not only talking to us, but also asking questions, watching the videos, watching the instructional pieces that we had for them as well. So.
Thank you, Dr. Doherty, for those words of parents. And I think the first thing I'd like to say is that I don't think anyone has had it easy during this pandemic, whether it's a parent or the teacher or the child. It's been a difficult situation for everyone. You know, we have parents that are nurses, that are first responders, that have been working very hard and around the clock as well. So I think this has just been a very difficult challenge for all of us. Our teachers have been amazing, and they have stepped up, and many teachers, they didn't go into teaching because they wanted to sit behind a computer screen. They want to be able to interact with kids and see them on a daily basis. And it was not an easy task to pivot to going to distance and virtual learning when they were trained to be interactive and engaging and run PBLs and have Socratic seminars and do all the cool things that get to go on in an interactive classroom. So they've had it very hard as well, but I wouldn't want to say that any group, parents, students, or teachers we've all had it hard, and it's been a difficult transition. I will say to Dr. Pope's comments earlier about all the training that teachers are going to get this summer to be able to even improve and step up the distance learning is critical, and will make the fall look very different for our virtual learners and those who have to stay at home for whatever reason. And in the worst case scenario, we end up having to go back to having 100% of students at home. To mention that there are going to be some opportunities for a focus group for lessons learned. There is a volunteer form that's going out that you can participate. You can put in information that you would like to participate in these focus groups, and they're going to be randomly selected from all the different stakeholders so that we can have some pretty rich discussions amongst all the stakeholders in virtual learning, from the people who implemented it to lessons they learned to the people receiving it. Even a student focus group is going to take place so that we can hear from parents that this is what virtual learning looked like in my house, and this is what went well, and this is what did not go well. So we can learn from our first whack at distance learning, and we will be better in the fall. I'm 100% sure of it. We will be better. Will it be perfect? No, because I personally think a perfect educational system has to be one that's face-to-face. I mean, we have to be with our children. But given the parameters of the pandemic, we need to have, as Dr. Taylor mentioned, our first priority has to be our health and safety of our staff and of our students. And we have to be mindful of that first. But yes, teachers, they're rock stars. They've always been in my book, and they always will be. And I know that they're going to do everything possible to bring the best education that we can put forward in the fall.
Thank you, Ms. Bailey. Before we discuss next steps and next dates, do you have some closing remarks you'd like to give as well?
Yes, I just want to thank, first of all of the staff for putting this town hall together. It's been a Herculean lift, done in a very short period of time. You guys have scheduled 9 different town hall meetings so that we can get and this, by the way, to the public, is at the request of the board because we really desire your input. I thank you all for attending today. Hopefully you've experienced a good dialogue. It's always good to hear community feedback and receive your input. It's very, very valuable to us. I understand that the situation is not good, as I just mentioned, for anyone. The school board collectively has 15 children in Chesterfield County Public Schools. So my colleagues on the board are right there with you, with their children in the school systems as well. We understand the potential difficulties that some parents will be facing. My board colleagues will also be facing those same challenges as parents. We as a board have to step back though and look at what is the best decision for our students, our staff, and all of our parents. We want to go back to normal, and we must take steps to ensure that normal happens sooner rather than later. I wish there was a clear and easy answer, very much so, but this situation is difficult, and there is no clear and easy answer. We have to examine all the information that we're given and weigh the best option and get our children a safe education. We'll make adjustments that will mitigate the gaps and provide an equitable education as we work together to navigate the pandemic. Please share with all of your friends and your neighbors all of the links to the town halls that we have coming up. As I said, it's 3 per day, Tuesday, Wednesday, and Thursday. And so over the next 2 days, we want to hear from them. We should also see another survey coming out in the next few weeks as we fine-tune the return to learning this fall. And once again, thanks for participating today. And I want you to know this, because I've been following on Facebook the comments throughout this meeting, and a lot of people seem to think that this is a decision that's already made. I can tell you that is not true. I have no idea at this moment in time what the best decision is. I'm listening. I am in listening mode, and I am taking in as much information, and I know my colleagues on the board are in the same place. So no, your voice matters, and we do want to hear from you. There has been no solid decision. So know that these meetings are valuable, and we do want to hear from you. Okay, well, thank you. That's the end of my comments.
Thank you, Ms. Bailey. Just a reminder, as she said, we've got 7 more community meetings coming up, including one tonight at 7 o'clock. There are 3 for each magisterial district, but if the times don't suit you, feel free to jump in anyone that you'd like. Share that with your neighbors and other family members as well. We want people to be involved in this discussion. The board is scheduled to vote on July 20th on an option. Again, we can't stress enough that as things continue to change, we will make adjustments as necessary, and we'll do everything that we can in our power to keep families updated. Thank you for joining us today, and we appreciate your support of Chesterfield County Public Schools. Have a great afternoon.